would like to introduce the last speaker, probably a keynote speaker. Since I do not recognize him as a dermatologist, I will probably have to introduce him as Mr. Scrooge.
Okay, thank you very much for the kind introduction. I'll try. How the fuck could you get up there? I haven't got a clue. There's no stair. How do you get an old man up there? Oh, yes, please. Oh, thank you very much. Oh, this is good. Well, I was asked by the organizing committee to scrutinize everybody's presentation because I've learned through the years that, in fact, they all lie. And we have seen the last presentation, and we know that Mark Meissner is one of the biggest liars, and he's trying to convince you about all things, and he comes up with a lot of data, and we also know that those data are all false. So, but because it's very difficult to really do that and go on the individual basis, that will hurt. I think Alan Davis already left the room because he's so scared. Oh no, he's still there because he's also from London, as I am. And I came in with an airplane. I've never seen an airplane before because I was just dead for 100 years. But okay, I'm here now. So let's first put all this meeting is a scientific meeting. It's how I don't have a clue why they call it science. But let's go for the first slide. I don't do that myself. I haven't got a clue how these things work. What is this? It doesn't work at all. Well, this is why I'm here. Everything we do, it's an illusion. It's nothing to do with reality. And if we go, whatever will be there next year, it will be really a problem because we think we are talking about reality, but there have been some significant changes in our observation. For instance, the Earth was flat, and now we think it's round, but we don't know. And the sun was revolving the Earth, which is also falsified. Now we think it's the other way around. But in fact, they are all observations, and we make models, and then we think it's realistic. I think I can go to the next slide. I'm slow, so take your time. Well, these are some past dogmas in which we also thought and had a lot of those scientific meetings telling us that this is the truth. And now you've seen that all those things already show you that there's nothing true at all. So what about this meeting? Is anything true what we are saying, or is it just, to keep ourselves busy? Next slide, please. This is also something, and it's really positive findings are around twice as likely to be published as negative findings. And that's really a cancer. And it's really true. Send a paper to a journal. Try to tell them that your results are negative, and they don't allow you to publish. How the hell can we then know what everybody is doing? Next slide, please. No, that's the preview. Oh no, this is we're going forward. Well, this is very dangerous here. It's so high. In our age, is Jesus. How do they get up there? But this is also dogmas in vascular surgery. We are fighting around the fact that is it endovenous or what's the other word? Surgery. And then you have ascending and descending. Luckily, Paul Peter Luger has left the audience because else I would have been killed. Because he is a believer. He is dogmatized by the ascending theory. and nobody knows. But it's just to illustrate that all those dogmas, we just haven't got a clue. May I have the next slide? Well, this is a nice one. It's a very good slide. I asked my assistant to make it, and this is the result. But I will explain it to you. We try to make one understanding of what's happening in the world. And we have chemistry, and we have physics, and we have mathematics. And one nice example is the fact that if somebody makes you scared and you suddenly go around like this, I have to be very scared here. And then what happens is that your heartbeat goes up, your pupils dilate, and it all happens in a split second. But have you ever imagined a neurotransmission site? It is as big as this room. There are a few molecules out there. They go at random through the space. They go from one side to the other side at random, and coincidentally they transmit the information. And then it still has to go through the blood. The adrenaline from your kidney has to go through the circulation to your heart. That takes 20 seconds. And still we believe that chemistry has something to do with this reaction. That's impossible. Before that all is done, I'm already dead because they killed me because I didn't fly fast enough. So this is a theory that doesn't fit. And in fact, I'm coming from an old London school, and in my opinion, there was already, in my century, quantum mechanics. We didn't tell anybody, but in my opinion, physics and chemistry do fit, but there's only one explanation. That the chemistry, all those molecules, they make a structure, and the structure is just a map for quantum mechanics to move electricity through that map. And if you do that and accept that the molecules are just a kind of a highway, they tell you where the quantum mechanics go, and then you indeed can have an instant reaction, because that's around speed of light. Because if you put sugar in your cup, you still have to twist it for 10 seconds before it's sweet all over the place. So chemistry is not the explanation of everything. So there's something wrong. We really have to move on and leave this silly model, because you can't explain it all. So reality again, we are on the wrong track. Next slide, please. If it takes too long, oh, the chairman left. Oh, that's strange. They were here. Now they are gone. Did they die? But if it takes too long, which might be possible because I'm a little bit slow, then just give me a signal. Randomized controlled trials. I'm happy that Mark already alluded to the fact that those are really the biggest flaw in science. Science, what a word. Biased design. First we make a protocol which is already biased from A to Z. Then we take not enough number, so we have the number needed to treat, and we always forget to tell the number you need to harm. That's something which is hardly ever in any publication. And then of course that's the type 2 error, which means that they need 2000 and they only do a series of 20 and still conclude from it. And that's nearly 90% of all publications in any journal. And then they come up with surrogate outcomes They mention only the relative influence and not the absolute risk reduction. So it's really horrible. And you listened to this already for 3 days. I got some information, but they sent a pigeon to me and I flew in London and told me what was done here. And I said, well, this is really amazing how people can spend their time on those lies. And then the worst thing happens. You have a very selective group in a randomized trial. And then they say, okay, now you can use it in your normal life. And they never, ever measure it again. So that nobody has an idea what in real life happens with the outcome you have shown in a randomized controlled trial. Nobody measures. And I know, and that's, now I know again what's on the next slide. Come on, the next slide, please. Oh yeah, now you see, they extrapolated to different physicians, different centers, different countries, different patients, different outcome. So what the heck, what are they talking about? It's nothing to do with reality, because they never measure. They should measure all that information afterwards and see if in real life that randomized controlled trial sticks to the outcome. And I can tell you, in 90% it's not. And then you get the, what's it called again? Industrial-driven and money-driven care. And that's what it's all about, because we don't do it for the patient, we do it for ourselves. Next slide. Oh yeah, and then there is the American registry. Oh, so good that they register everything. But then if you calculate what happens in real life, then they only come up with data of 0.2% of everything done in the States. So throw it away. 100% registries, that's what we need. But this is bullshit. So forget it. Next slide. Oh, it's getting worse. Significant. I know that there is a how do you call those guys? Epidemiologists and statisticians. And I know there's one in the audience. I've seen him. He's gray, and he is as not trustworthy at all, because he can calculate significant outcomes out of any data. It just, you use the right formula, and then you have a positive outcome, and then you have a nice study, then you get refunded, then you get a publication, then you don't perish, so you publish. So we have pain scores. Everybody knows venous surgery is famous for it. All the laser companies fought for the best fiber, and the only thing they came up that one fiber has a pain score on day 3 between 10 and 11 o'clock of 2.4, and the others have a pain score of 2.5, and that was highly significant. So really, again, really, this is progress. At least that's what they say. Or quality of life increase. It's also, you can have on those questionnaires who hardly have anything to do with real quality of life, they also go up and down. And then you have all kinds of definitions: occlusion, insufficiency, recanalization rates. And in every publication, the definition is different. And still we put them together. Again, of course, Mark Meissner showed so nice that those meta-analysis of all shit plus shit plus shit, and then you keep up having shit. You cannot change shit into something good. Can I have a next slide, please? Oh, here, oh no, yeah, one back, or forward. This is also happening. We have a very nice list of scientists who made up everything. And there's nothing related to real world. May I have a slide back, please? Yeah, oh, meta-analysis, that's the way to go. Shit plus shit plus shit is shit. If you remember this of my presentation, then I think you're on the right track. Because this is science, and the number needed to treat shit is, well, you can treat shit with shit, but you can take some toilet paper, but you have to think out of the box, because if you stay in the shit, you can never clean it. So you have to do something different. Okay, then you have the methodology. That's a difficult word. Methodology score. Well, in fact, those Lancet and New England Journal, those are journals where only publish very good data. But if you ask a methodologist to analyze the published papers, it's rubbish. You can get 100 points for a well-performed trial, but they're all shit. So you keep on even having the Lancet with shit, because they also don't measure it in real life. Next data. Jesus, I'm getting tired here. Strange. Oh, this is also so nice. I heard from a member of the American Venous Forum that there was a presentation on increasing flow in the leg. We know we have those compressive stockings, the pneumatic ones. They do well, but they were able to show if you put your leg in a kind of a machine and it's twisted around by, I can try to show you, it goes like this, and then they showed that it's a 5% increase in venous flow. Could you see a ward with all those patients and those machines lying there, just twisted? So what the fuck are they doing? Is this science? Oh, and then there was a group that was in the same session, I believe. Then there was the ones that put neurostimulators on the skin of the calf to get them just contract, and then the flow increased too. They didn't mention if you move your leg a little bit, like I'm trying to do, and you squeeze to the neurotransmitter, you really get electrocuted, and it hurts like hell. So those two nicely performed randomized controlled trials are terrible. Well, that's science. Next slide. Guidelines. That's also funny. Cava filters. In America, they use 300,000 a year. In Europe, now it says 10, but let's make it 1,000. But the incidence of pulmonary emboli or dying patients between those two, let's say, continents is 0. But they earn so much money on those retrievable, not retrieved Cava filters. So that's why they drive more nice cars than we do. So maybe we should introduce it here. Okay, well, everybody knows guidelines should be universal. Here in Europe, every country suffers for 2 years to make a guideline, and it's all the same data. Oh yeah, and of course, remember, it's in all those data, shit plus shit plus shit is shit. Next slide. Ethical issues. Now we're getting on a very difficult page. I've asked in my century doctors what they would do with their patients if they have a disease and that they want to be treated. And normally you'd give a patient a treatment that you would also do on yourself. But coming in 2014, I heard that if you ask a doctor if they would, with a carotid stenosis, and then they would, what the treatment they have if it's symptomatic, then everybody says, I want surgery. But more than 50% of their patients are sent for stenting, which they never want themselves or their children or their parents, if you have nice parents, of course. So it's strange. It even now I think Cava filters. Nobody wants those things, not in your own body. Aortic endografts is also something which I think times have changed. But if you would ask a surgeon 5 years ago, and he could be operated, they all want open surgery. And still they put in 80% of their patients, they use those ugly stents. You have to be controlled for the rest of your life. You still get ruptures. So it makes a lot of money, but it's terrible. So let's be aware that there are ethical issues. You don't have to be better than God, although the only difference between a surgeon and God is, of course, that God cannot operate. Next slide. The future. Yeah, I haven't got a clue, but we have to do something about the science. Quality of science score. I think if we make this very well, we end up to throw away more than 90% of all the publications. So, may I have the next slide? This one is important. I think, being dead for 100 years, that all scientific communication should be communicated about all positive and negative findings in specific subject-related journals or websites with a very, very low threshold. And that's for all the scientists. But for the real people, we just published the less than 1% interesting information in a journal, and those are the clinically important outcomes influencing daily practice, logistics, and our guidelines. And that would help the physician, because that stack of papers that you have to read to find maybe 1% of sensible issues that you can use in your practice. So we have to select them for them. That makes it easy and puts them in those universal guidelines. Next. I hope I'm nearly there. Conclusion. Finally. How do I ever get down here? Okay. Realize that all explanations are just models to explain observations, and they change constantly. Do not ever, ever think that what you see and what you get is reality. Those are all models. And the moment an observation comes up that doesn't fit the model, reality changes. But we are far away from reality. So life is an illusion. Enjoy it. And that's why I understand that you for 3 days have yourself talked to by all those interesting papers, and you think it's worth it. Funny. Never advise your patient a treatment you would not advise for your parents, children, or yourself. Remember that. I think that's key in being a doctor. And don't go for the money, although it's nice. Or make always always a note if you love your parents, for if you love your children, and if you love yourself. Because if that's not true, this statement doesn't make any sense. Extrapolate randomized control trial outcome has to be checked. We need to control it when we have it in the world. Then we know where we are heading. And then only publish clinical relevant data that will help. And then I think there is one final slide. Yes. I get tired. Stay open-minded and don't talk with you. All those medical meetings, they talk with medical people, the most narrow-minded species on earth. Just speak to other disciplines. Nanotechnology, chemistry, oil industry, that's where you find solutions for your patients. Not talking to your colleagues because they are as stupid as you are. So forget that. And science, I tried to explain that to you, is very, very temporary. Thank you for your attention, and I don't take questions.
Thank you, Mr. Scrooge, for this innovative way of presenting science and your uplifting remarks at the end.